Hello, my name is Ralf Friedrichs. I'm an addiction recovery coach, a life coach, and the host of this show, Take Your Life Back Today show. Very sunny day today. I want to talk about how drug overdoses might actually be suicides. Think about that. More likely to be classified as accidental or undetermined cause compared to the deaths by gunshot or hanging, says researchers in the United States. Are they actually suicides or are they actually overdoses? Well, let's talk about that. With drug overdoses, there are often few clues to suggest suicide, such as suicide note, according to the first large study in the U.S. death investigations, and inherent biases in determining the manner of death. The opiate epidemic is killing more people every year at a higher rate, said lead author Ian Rockett, a professor of environmental and the West Virginia University of Public Health in Morgantown, West Virginia. Death investigation systems are highly stressed. They're overworked. It's going to make it very difficult to do any kind of assessment we need to do about their intentionality. He believes that 32% of all overdoses are actually suicides, that they're actually being caused purposely. It is impossible to know how many drug intoxication deaths have been written off as accidents. Therefore, the problem with inaccurate suicide accounting is that it impedes our understanding and prevention of suicide and drug deaths, says Rockett. In a telephone interview, that is what he stated. The researchers scrutinized 36,190 suicides and 4,391 undetermined deaths among people 15 years of age and older, using data from 17 states in the U.S. National Violent Death Reporting System. This was done between 2011 and 2013. They looked at the demographics of participating circumstances and investigation characteristics of each case. They also explored whether information about a suicide note, knowledge of a prior suicide attempt, or a psychiatric history of depression or bipolar disorder increased the odds that a death would be classified as a suicide. This kind of corroborative evidence was much more important for helping medical examiners and coroners detect drug intoxication suicides, and it was in for the deaths by shooting or hanging, the study found, my friends. The existence of suicide note increased the odds 45-fold that a drug overdose death would be classified as a suicide, whereas a note only raised the odds of classifying a gunshot or a hanging death as suicides by 8-fold. The researchers report this in a local paper. When the deceased had a prior suicide attempt, death investigation teams were 2.4 times more likely to classify it as suicide than without such a history. When descendants had documented bipolar depression or bipolar depression, they were 61% and 41% respectively more likely to be classified as a suicide than someone without a psychiatric disorder. If I want to caution, I do want to caution everybody about being called a potential suicide, because if we make it a very certain group, it stops having meaning and it's hard to understand the factors that contribute to suicide, said Jill Friedman, Vice President of Research at the American Foundation for Suicide Research in New York, who wasn't involved in the study at all. Not every overdose is a suicide. We want to be as clear as we can when you're calling something a death by suicide, she said. Folks, think about this. Call me at 844-405-HELP, and together we can help each other take our lives back. And let's be careful about suicides and overdoses. Be good to yourselves and be good to others. And always remember, God loves you, and God bless you all. And please say no to drugs, say no to alcohol, and say yes to God. May God bless you. Take care.